Hello and welcome to my podcast. It's your girl Whitney, aka Miss Sterilizer. I'm here with my fiance, who has been watching me go through this whole sterile processing journey. And we're going to talk a little bit about my favorite things regarding my journey in school. So introduce yourself, fiance.
Hey everybody, my name is William.
Okay, my co-host, what questions do you have for me?
So I would like to start off with saying, what is your favorite subject to learn about with surgical instrumentation?
So, my favorite subject was learning about the Da Vinci robot system. It is a robotic system used to perform surgeries, and it's a little crazy.
Speaking of surgery, how long has it been used in surgery?
The Da Vinci it got cleared by the FDA in July of 2000.
Okay, so when was your first time seeing a Da Vinci robot?
My first time seeing one was when I was very, very young, watching Grey's Anatomy with my grandma. And it was an episode where Dr. Bailey finally got to use a Da Vinci. I forget the guy's name who did the whole process so that they could get the machines, but she literally was, in the very next scene, she was removing a gallbladder with the Da Vinci while she was making lightsaber noises. And I thought that was real cool, real chill. Kind of made me interested to see, more. I was a little too young to understand what it was then, but now that I'm learning about it, I kind of want to learn more about it. I'm very much interested. I could very much see myself being a surgical tech using a Da Vinci robotic system.
Are there multiple steps to using the Da Vinci robot? What are the main parts?
The main parts of the Da Vinci are going to be, so they have a control center where the surgeon sits. They have a screen that's HD and 3D, so they get those views of the surgical site. And then the control center has the controls, and I call them joysticks because that's what they look like. I don't know what they're actually called. There is a patient cart that stays next to the surgeon, and it holds the arms, probably the arms that aren't being used at the time or are in the way, and other tools needed. They have a vision cart, which is probably one of the most important parts, so that the surgeon can see, everybody in the room can see. There's two screens. There's one for the surgeon and there's one for everybody else, the surgical team, so that everybody can witness the procedure just in case, the surgeon needs help with anything. And then the actual instruments are called endo-wrist instruments. I believe they rotate 360. They clamp, they cut, they coagulate or help with coagulation. They might actually do the coagulation. They dissect, they suture, and they manipulate tissue. Well, the surgeon does all of that with the endo-wrist, I should say.
So are there better results using the Da Vinci as opposed to a normal surgery, without the robot?
I think that they have pros and cons for each. So one of the pros for the Da Vinci is it's less invasive than general open surgery.
Mm-hmm.
Because it's an endoscopic instrument, so everything is very, 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 very small, slender, precise to get underneath and in between tissues. And of course, it's a lot of tools that, with the actual instruments and the camera, they are very, very small. But there is a faster recovery time for the Da Vinci system. There are fewer side effects after surgery, probably because they're more smaller, less invasive surgeries.
Okay, so like I'm sure they use the Da Vinci robot for all kinds of surgery, but are there some surgeries that they aren't used for? Like they rather not use the robot and just use regular surgical tools.
Ask me that question again.
What kind of surgery is the Da Vinci used for?
So there are a lot of different types of surgery that the Da Vinci is used for. So there's a colostomy, which I know probably sounds familiar to you. You know, colostomy bags. That is basically making a new opening for feces to come out. Endometrial ablation. You know what that is?
No, what's that?
Basically, they use heat. The surgeons use heat and cold to destroy the lining of the uterus to treat menstrual problems. So, like heavy bleeding and stuff like that.
Oh, so this the
like
tool,
endometriosis. You know, that's
yeah. So this the tool they mainly use for like hysterectomies.
They do, yes. Yeah. Anything that removing something small. So we got gallbladder removal, gastric sleeve surgery, aka gastric bypass. You know what that's for, right?
Yeah.
Feeding tube placement. That's one I didn't know.
Well, yeah, I can see it. Well, does the success rate of the surgery, is it like, is it a high success rate?
Hold on, because I wasn't done. Mitral valve repair. Do you know what that is?
Valve repair. I know valve repair has something to do with, like, probably the heart.
It's basically repairing the door that connects the heart's left atrium and left ventricle. This is a hard one. Polypectomy. Do you know what that is?
No.
Removing polyps from inside of organs.
What is a polyp?
I think it's like an abscess.
Oh, okay.
And then the splenectomy, removal of the spleen, and tonsillectomy, removing the tonsils.
As I was saying, right before you finished, I said, what is the success rate of the surgery?
According to Cleveland Clinic, the success rate of the Da Vinci system is about 94 to 100%.
That's pretty good. Let's see. What else can we do?
So even though the success rate is 94 to 100%, Drug Watch states that there are complications that do happen. So with the Da Vinci system, there are longer operation and anesthesia times. So, which makes sense because you can't actually feel what you're doing. I feel like that takes a big, it makes a difference to be able to feel what you're doing, feel around, versus watching on a screen and using foreign objects to do things that you probably couldn't normally do with your hands. There's also device malfunction.
Okay, so when you
'Cause,
say device malfunction, sorry for interrupting you. Is there like a way that they go about to repair it in the timely matter, or they have to wait?
I'm pretty sure it's a waiting game.
Mm-hmm.
Not like a super long wait, but most of the time they won't know that something is wrong until something goes wrong. So, but I think the wait shouldn't be too long. If anything, they'll probably ship the malfunctioning device out and loan a new one.
Mm-hmm. So they probably got like little things to replace it for the time being.
Yeah. Bleeding is a big one.
Mm-hmm.
I think they call it hemorrhaging, but that would make sense because once again, I feel like being a surgeon or operating these devices, you really have to feel what you're doing sometimes. Like
Right.
this, a Da Vinci is not a all the time go-to for surgery. There can also be gas and air trapped beneath the skin. Still, I feel like not being able to feel what you're doing. Infection. And I believe that this is mainly because it's hard to clean those devices. They're so small and just so like delicate.
Yeah, it's hard to clean a robot like that.
It's hard to clean anything like that. Even like the regular tools that have no electric components. The really, really, really small ones are really regular. Endoscopes are extremely hard to clean. You know, I had that one assignment where I had to clean those little instruments, and it wasn't good.
But you did it.
I did. Any more questions, sir?
I don't have any more.
That's it.
Yes.
All right, and that concludes my first episode. Once again, it's your girl, Whitney, aka Miss Stera, Liza. And I'll probably see y'all on the next episode. Maybe, maybe not.